Hello, everyone. I'd like to welcome you to Northwest Suburban's College COVID-19 Where Are We Now conference. I am Claudicia Sappho. I am a pharmacy technician and a professor for the Northwest Suburban Community College. We know that the pandemic has brought us many things, unfortunately, a lot of grief, heartache, and a lot of things that have brought us down and adversities. But one good thing it has brought us is the networking and the getting together with others. It's also brought us some good things as far as advancements in medicine. So we have brought this conference to you so that you are able to keep yourself informed with the most up-to-date information as far as what is going on now. And so that you can feel comfortable in giving extra info to a family member, a friend, or a coworker that comes from credible sources. Without further ado, I would like to thank all of our panelists for joining us for this event. And I'd like to also say that Northwest Suburban College offers programs for advancements and career opportunities for affordable education. Let's move into our first presenter here, who is Dr. Craig Klugman. He is a Vincent DePaul Professor of Bioethics and Health Humanities to DePaul University, where he co-directs the Bioethics Society minor program and has been working on the university's response to the pandemic. Dr. Klugman also serves on the ethics committee at Northwestern University Hospital and is co-founder of the Health Humanities Consortium and is a voting member of the National Biodefense Science Board. We may have heard recently that the CDC and the FDA has recommended a third booster shot for those who have received the Pfizer vaccine. Some of us may be asking if this applies to us, or does it make sense if there are many people who have yet to receive the first dose of this vaccine. Right now, Dr. Klugman will bring to us his speech on COVID-19 vaccine distribution and the global justice issue. You have the floor, Dr. Klugman.
Great, thank you very much. Sorry, my computer decided this is a good time not to work. Okay, well, thank you very much. So you can see I have some dates here, September 25th, which is today. It's also the 555th day since the pandemic began, at least for me, when my university announced it was shutting down and we moved all our lives online. So where we are at today, we have had in the United States, 43 million cases reported of COVID-19, and we've had 688,000 deaths, which if you've looked at recently, that is more raw deaths than the number of people who died in the 1918 to 1920 flu pandemic in the United States. But per capita, it is about a third of the death rate from back then. In terms of vaccination, we have given out over, this is worldwide, 6 billion vaccine doses. That's B as in billion, as you can see at the top of my screen. We have actually given out enough doses that we could have vaccinated 1/3 of the entire population of the world. We have not, but we could have done that. Here in the United States, you can see that we have, oops, I'm sorry, it looks like everything crashed on my system. As you will hopefully be able to see in a moment, there's always happens. Let's see, okay. My apologies for that. Okay, one more time. Okay, so as you can see, we have given out we have 183 million Americans who have been fully vaccinated. And this is 55% of our entire population. As you'll learn today, that in order to achieve herd immunity, or the amount of people vaccinated where we would be limiting the spread of COVID-19, we probably would have needed to achieve about 75% under the Alpha variant. Well, we are now under the Delta variant, which estimates are saying we should have about 85%. So we still have about 30% of our population that we still need to get the first vaccination done with, not even talking about our boosters. The other thing you'll notice interesting on this chart, which comes from the CDC, is that we have given out already, and this is as of this morning, almost 2.5 million third doses, right? This was approved, the third dose was approved yesterday. And yet in the last month, we have given out over 2.5 million third doses, additional vaccines. And I would say this is an undercount, because I know people who went to their local pharmacy and lied, said, oh no, it's my first dose, in order to get a third dose before we were even able to track this. So I would guess that the federal data is actually underestimating the number. Now, this whole story about boosters starts about 2 months ago, the end of July, beginning of August, and there were 2 papers released. The question that we had not been able to answer at this point was, given that we had started giving out vaccines in mid-December, how long were they effective? We know from our experience with the annual flu vaccines and with other vaccines that it was unlikely with a rapidly mutating virus that we would have lifetime immunity, and the need for some sort of a booster would be necessary over time. And so these 2 articles came out. This first one in the upper corner, this was actually on a preprint server, which means it was not peer reviewed, it was not accepted for a medical journal. But what it's found was that among the very first people in Israel, which was one of the first countries to do mass vaccinations, that for people over age 60, there was a decrease in the protection that the vaccine provided for them. There was increased hospitalization, there was increased breakthrough infections for them in the over 60. The second piece that also came out at the very end of July was looking at, if you gave a booster vaccine to that very same group, did they have an increase in the number of antibodies they had, which is their potential to fight the infection, as well as a decrease in hospitalizations. It turned out, again, for people over 60, that there was a change. For people under 60, there really wasn't a change. And so we kind of had this answer that about 146 days, 6 months to 8 months, you would see a decrease in certain populations in their capacity for fighting off the infection. And this is where the discussion began, because the White House immediately after this came out and announced their plan to give a third or booster dose to the whole country. And we know yesterday that the science doesn't quite support that, and we have something slightly different. So yesterday, what was announced was that for people who got the Pfizer vaccine, and this is only Pfizer, if you got Johnson & Johnson, if you got Moderna, that data is, in some cases, not been submitted yet, in some cases being analyzed right now. But basically, if you got Pfizer and you are over age 65, then you should get a third vaccine. If you are under 65, but you have an immunocompromising disease, you should consider getting a third vaccine. And if you live in a long-term care facility, or you have an occupation that puts you or the people you care for at risk. So if you work in healthcare, if you are a K through 12 teacher, if you work in a senior home, you should consider getting a third vaccine. And the considering is pretty important. And it's something that you probably want to talk about with your doctor, whether you should actually do it. But this was the recommendation that was just made yesterday for us. And again, this applies only to people who got the Pfizer shot. At the same time that this Israeli studies came out and that the US was considering its plan, the World Health Organization came out very much against the idea of boosters and third vaccines. And the Director General of the World Health Organization said, look, I understand the concern of all governments to protect their people from Delta, but we cannot and we should not accept countries that have already used most of the global supply of vaccine, using even more of it, while the world's most vulnerable people remain unprotected. We need an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries. And what he raised was this idea that perhaps there hasn't been a just or equitable distribution of vaccine across the world. Remember I said in the first slide before it crashed that we could have vaccinated 1/3 of the people in the world, and we haven't. So where have these vaccine doses gone? I'm sorry, this was an update. We've given 6 billion doses in over 184 countries. And you can see on this map, the darker green is where more of the vaccines have gone, which tend to be the global north, the wealthier countries. When you look at the global south and low and middle income countries, you'll see there has been far less vaccine. In fact, some countries have received like 4 doses. Well, if we look at where do people live, where is the percent of our world population? 9% of people live in high-income countries, the United States, Canada, Western Europe, 9%. 76%, 3/4 of the world population live in what are called middle-income countries. This is China, this is India, this is the vast majority of the world. And then 16% of people live in low-income countries, the very poorest nations. Where has the vaccine gone? 87% of all vaccine manufactured has gone to high-income countries. 12.98%, and that specificity becomes important in a moment, 12.98% went to middle-income countries, and 0.2% have gone to low-income countries. The result of this is that about 51% on average of people in high-income countries are vaccinated, 31% of people in middle income, and 14% in low income. And if we put this all together, we can see that the vast majority of doses have not gone where the population is. The vast majority of doses have gone to the high-income countries, which are well protected. Again, it's not the 85%, but they are much better protected than any other country. And 9% of the world population has gotten 87% of the world's doses. Is this fair? Is this just? These are the kinds of questions that we need to think about as we consider, as we now have embarked on this. Many people were not happy. A lot of the pundits were not happy that the recommendation from the CDC and the FDA was not that everybody who got Pfizer should get another dose. That's what some people were pushing for and expected. But as you can see, there is a fairness question. And because we have a global pandemic, inoculating all of the United States is not going to solve it. We would still have mutations evolving. We would have them coming here. This needs a worldwide solution, and we haven't done that yet. What we have been practicing is something called vaccine nationalism. And according to the Rand Corporation, vaccine nationalism is a situation where countries push to get first access to a supply of vaccines and potentially hoard key inputs for vaccine production. So not only have we gotten most doses of the vaccine, but we actually control most of the raw ingredients for making these vaccines. When Delta first hit India, and it was a huge, massive, disastrous outbreak that they were not prepared for, and they had a very low rate of vaccination compared to us, we had to send not just vaccines, but we sent the raw materials that they could manufacture their own vaccines because we control that. So this is vaccine nationalism, and it's about us controlling and making sure that we get our doses first before the rest of the world. Sorry about this. When you think about what vaccine nationalism, like the reasons in favor of it that have been offered are that, the world's large economies, they'll bounce back faster. We'll get the world out of its global economic slump. We can then lead the world. Sort of a trickle-down effect that if the top high-income countries are doing okay, then the lower-income ones will follow. We actually pay a much higher price for our vaccine than other countries around the world. Remember, we put up several $billions before the vaccine was developed. We pre-bought our doses in a way to spur and to pay for research and development. And so we're just getting our due now. So we should get the first rewards because we put in the first money. but our higher prices will subsidize vaccines for the rest of the world. On the not so great side is, well, pandemic is global. And we can say, well, goodness, we need to give it to we can say that, there's this trickle down and give it to the first world countries. But the reality is we're going to still get mutations. It's still, as people are traveling and moving, we are going to still be getting mutations around the world, and we need a global solution, not a local one. Also, our economy is globalized, that if you have parts of the world that are behind in terms of vaccination, the whole global economy can't be fixed anyway. Plus, all human life is equally valuable. Just because somebody happens to be born in the United States versus Ghana doesn't make their life more or less valuable. And so if we want to think of all people as being of equal worth, then we need to change the way we're distributing vaccine. One of the ways we have done this is through a global program called COVAX, which is a consortium among a number of groups, non-governmental organizations, some governments, and it's all being managed by the World Health Organization, the WHO. And their goal is to procure vaccine and distribute it to middle and low income countries, what is also known as the Global South. Their goal originally was to create 2 billion doses for 2021. That's what they wanted to purchase. And they have donations from other countries of about $2.5 billion US to do this. But it turns out that's not working. That a lot of the countries that promised money aren't delivering the money, and we're certainly not giving them all the doses of vaccine. Now, you may notice that President Biden this week offered another 500 million doses to the world, but how that's going to work is not been worked out yet. But in the new target for COVAX, instead of 2.1 billion is 1.4 billion, which is a decrease of 25%. And we now know that there are parts of the world that are unlikely to see a vaccine till 2023 because of our current distribution. And so the question becomes here, what is fair? What is just when you're looking at third doses, booster doses for the United States versus places in the world that haven't seen anything? There are different ways in philosophy and bioethics that we think about how we distribute scarce resources. And right now, vaccine is still scarce. Even though here in the United States, you can pretty much go anywhere with it. Here in Chicago, you can call up the Department of Public Health and they will come to your home, they will come to your office, and they will vaccinate up to 11 people. But in the rest of the world, that's not the case. So we can treat everybody egalitarian. Everybody's the same, we treat likes alike. We could have a lottery of who gets it. We could do first come, first serve, which is what's happening with the boosters. But you consider everybody to be the same, look alike. We can look at contribution. So what one gives or does. In a lot of cases, this is about money. And this is how the vaccine has been distributed. The way you get 87% of the doses to 9% of the world's population is it's been money. So it's been profit. Who can pay the most is who gets the vaccine. We could base it on merit, celebrity status, moral worth, or a talent. We could say high-income countries should have this because they are the world leaders, they will get the world economy going. That's where that argument comes from. It can be based on medical need, the medical criteria, triage, who has the most cases. And in some measures, the United States does have one of the worst outbreaks in the world, but other parts of the global north do not. And then lastly is dessert, which is also, it's actually pronounced dessert, even though it's spelled desert. And this is about your personal responsibility. So should we be giving vaccines and even hospital beds to people who are not wearing masks, not physically distancing, who actually refuse to take some responsibility for their own health care? Now, within the world of bioethics, Nancy Berlinger, who's a bioethicist at the Hastings Center, said we should think about distribution on 3 qualities. We should look at the scientific evidence, which we've seen. We've looked at the question of global justice and the question of equity, getting everybody there. Owen Schaefer, who is a bioethicist in the National University of Singapore, believes that there's a concept of fair priority that we should be, it's a very complicated formula he's developed about where we should prioritize our resources. And giving a third dose to places that already have doses violates his notion of fair priority. On the other side, We have the pharmaceutical companies saying, we've got enough. If you give us more money and more resources, we'll produce enough vaccines. And so this is a false dichotomy. It's not an either or. Of course, that hasn't played out in reality, but that is what they're saying. So if we look at the US data, and these studies all came out the very end of August, what we can see here, if you compare the CDC numbers, is that there hasn't been, for the vast majority of the population, there hasn't been an increase in hospitalization. There has been some increase in cases, but there hasn't been increases in hospitalization, and there have not been increases in death. There are other things we worry about with COVID than just death and hospitalization. We've got long COVID that we're going to hear about later. That is a big concern that we don't really understand. We know that 1/3 of people who have had a COVID infection have changes to their brain. And this is something concerning because we're not sure what that means yet. But what we can see here is that there really hasn't been a decrease for the vast majority of the population in the United States in the effectiveness of the vaccine. So that's why you didn't see for everybody in the Pfizer vaccine, because the data doesn't support it. Now, the WHO says, look, let's take a pause. Let's not do booster shots in any country for the rest of the year. Let's give it a few months. And what the executive director of the Health Emergency Program has said is, look, we're planning to hand out extra life jackets to people who already have life jackets, while we're leaving other people to drown without a single life jacket. That's how he sums up this question debate. So the question remains, what is fair and what is just on a scale of the whole world? Thank you. Time for questions.
Okay, thank you so much, Dr. Klugman, for that information. I have a few questions here from YouTube. There is one that says, how many Americans have gotten their first dose?
So that comes out to be about 71% of people have gotten their first dose. But I think it's a misnomer to be reporting first doses, because vaccination, if you're Johnson & Johnson, it's 1 dose, although the latest data says you really need 2. And the other 2, the Pfizer and Moderna, are 2 doses. So a first dose doesn't mean anything. You are not vaccinated. So that's why I only reported the 55% fully vaccinated, not the 71, 72% that have received a first dose.
Okay, thank you. And then our next question says, how many refusers are there to get the vaccine? Do we keep track of the people who are refusing?
We don't really have a way to do that. There's an assumption that the 45% who are not vaccinated either lack information, they may have hesitancy. We know that there's some access issues involved here, like being able to get time off of work to be able to go during the hours that the pharmacy is open. Transportation issues. We do know that there are deserts, places that don't have pharmacies or health clinics. Those have been issues. But again, at least here in the city of Chicago, you can call up the public health department and they will send somebody to your home or your office. So we're kind of working on the access issue. We do know that vaccine uptake and hesitancy is highest in communities of color, communities of lower socioeconomic status. The highest uptake is in seniors. We do know that. They have the highest rate. And the lowest is sort of in your 18 to 49-year-old group, in part of sense that they tend to feel less mortality. Hospitalizations are being highest in younger kids now. So like the 5 to 29 age group, that's sort of where we're seeing a huge increase in hospitalizations. And whether that's something about Delta, that it hits younger people than the Alpha variant did, or it's just they are less likely to be vaccinated. I mean, when you go to hospitals and you look at who's there, it is 97, 98% of the people in the hospital are unvaccinated. So that is, you've heard this several times from the federal government. This is a pandemic of the unvaccinated, which is partially true. I mean, it's a pandemic, it hits everybody. But the people who are getting sickest, the people who are dying, tend to be unvaccinated.
Okay, thank you for that. And then This looks like our last question, unless one came through here. It looks like, okay, so here's the next question. It says, with so many not vaccinated, what is the possibility of even more dangerous variants emerging? I think you may have somewhat answered that, but I don't know if you want to elaborate.
I mean, I can't give it a number. I'm not a statistician, but there is definitely this risk. Wherever you have a population that's unvaccinated, the possibility of a mutation evolving is there. It does exist. We know that we're dealing with Delta now. We know that there's a Mu variant that came out of South America that seems to be a little worrisome because in the places where it has hit hard, it has infected even people who were previously infected. And so there's a question of whether it somehow gets around the immunity that we have developed and have given ourselves. The nightmare scenario is developing a mutation that basically gets around the antibodies that we have gotten with our vaccines. That it's enough that it kind of gets around our defense systems. And then we're basically starting off with square one. So Mu hasn't spread hugely yet. It is in the majority of US states, I think 48, 49 of them. So it's a mutation of interest. And so they're out there. And there are a lot of mutations that we don't even know about. And the longer this goes on, and the fewer people who are vaccinated, the more chances there are of a dangerous mutation evolving. So yes, it is a concern.
Okay, thank you. And we'll make this our last question for the sake of time. And this question says, when we look at the rates of other countries with high vaccination rates, we are seeing an increase in numbers. Why?
I would need some more specifics than just that. Well, some of the increases that actually, remember I said you needed to have on alpha like 70, 75% and on delta like 85% to achieve that herd immunity. So what you're seeing is delta is more infectious, right? So alpha, if a person had alpha, they would likely infect one or two other people. With delta, one person infected is likely to infect 5 to 8 other people. So it's a huge, massive increase. So there is just more, and there's just more going around and more people getting infected. This is mostly among the unvaccinated, right? So we are seeing a mutation that really targets people who lack the full vaccination status. And that's why you're seeing more numbers. And that is why we need a larger percent of our population to be vaccinated to achieve herd immunity now. In fact, in some quarters, they believe herd immunity, we've sort of passed that, like that's not going to be possible anymore. There's a few people talking about that. So it really is just that this mutation is that much more, it spreads that much more easily to that many more people. And there are very few places that have achieved the level of protection that will stop the spread.
Okay, thank you so much again, Dr. Klugman.
My pleasure.
Now we will move on to our next speaker, which is going to be Dr. Michael Kalis.